respectful guests and participants at Al-Zaytuna University. And I would like also to apologize for the delay due to the late arrival of the Minister of Health. And let's start with the first note speaker, Professor Dr. Early Johnny, Dean Faculty of Pharmacy at the Faculty of Pharmacy of Toledo University, USA. And I prefer to give my colleague, Dr. Muhammad, to introduce him because he was his professor at Toledo University.
Assalamu alaikum. Hello everybody. It's my pleasure as one of the alumni to introduce Professor Johnny Early, Dean, College of Pharmacy, University of Toledo. Professor Early actually achieved so many awards and huge achievements in his academic life. He got the Purdue University Distinguished Alumnus Award, the African American Legacy Award, as well as the Martin Luther King Drum Major Award, Chauncey Cooper Award, National Pharmaceutical Association, Wendell Hill Award, Association of Black Health Systems Pharmacists, and named among the 50 most influential pharmacists by American Druggist magazine. And he was the Man of the Year for the Third Baptist Church. We're really happy and delighted to have you, Professor Early, in Amman and at Zaytuna University. And we'd love to hear from you about the pharmacists, how pharmacists provide worldwide care. Thank you.
Assalamu alaikum. Thank you for that warm introduction. And it's amazing and pleasing to come this far from home and be introduced by introduced by one of our own alums, especially one who graduated in 1998. I wanted to say to you this evening that we all share a wonderful profession, a caring and a giving profession, and it's a very essential profession as well. From Doha to Detroit, from Amman to Atlanta, pharmacists are the people who really make things happen in the healthcare system. They're the last and most vital step in achieving or maintaining health. Whether it be from the laboratory or the pharmacy counter, pharmacists are quite important to the healthcare process.
شباب الصوت فوليوم.
From the very beginning of time, the water pestle, which is one of the worldwide symbols of pharmacy, has been used in order to make things, medication, of course, to help with to create herbs, food and cosmetics, and also up to date, the celebrity chefs use the water pestle. And some of the favorite ones that I have seen, this is a similar one, traditional Chinese medicine, where they use brass as the mortar and pestle in order to help make things happen. No matter what we'll call pharmacists, druggists, chemists, the root of all that we do is the same. And the key thing here is that pharmacy is open to meet patient needs. We're always there to care for the people. I have some examples as I go through the presentation here of pharmacists to show that what we do is more than being simply a dispensary. We give advice and healthy living. We provide various kinds of care. The pharmacist, Nina Arai, also talked about the pediatric antibiotic prescription business that she has. She regularly talks to and listens to the patients as they come in, and she then found in one particular case the child had a chest infection, and she also realized that the mother was a smoker. And so, of course, she put two and two together and suggested that the smoking might occur in the presence of the child as one step. And also, she is a person who is trained to help people stop smoking, so she can work with the parent to change that part of her lifestyle. The area of greatest need within pharmacy, of course, is in the community, because that's where pharmacies and pharmacists are most plentiful and where everybody comes in to see the local pharmacist. We're available to all. The largest practice domain is represented here, and we know that patient assessment skills, not diagnosis, but for instance, patient assessment skills are very important when people come in to be able to understand what's going on in that person's life at that moment. This pharmacist had a patient also to complain about heartburn. And of course, if you've been around anyone who's had a cardiac event, that is one of the things that you want to pay attention to, because it could say that something more significant, life-threatening or life-ending, is going on or about to happen. And so she advised this particular patient to seek emergency care, and that was a lifesaver because it was a heart attack that was happening. Those things are quite important to the general public because they would misunderstand those. I even have physician friends who had misdiagnosed themselves when having a heart attack. We don't believe it sometimes when it happens to us. A day in the practice here, these are actually students at the University of Toledo. We will see that in the hospital or institutional environment, we refer to those pharmacists as being clinical pharmacists. And that is because of the fact that they have a lot of access to laboratory and other data in the medical center or in the hospital. All of us, no matter where we are drug experts. In that setting, the pharmacist provides medication therapy evaluations to patients and other professionals. Other is important here because everyone depends on us for what we know and what we can do and provide. The institutional practice, as we described it as clinical, I explained a second ago, in terms of having a key value or asset of having access to a lot of data that helps you understand the patient's condition. The clinical practice affords a laboratory, access to laboratory values and many other pieces of data. Is the point of care. Testing is in the community that allows us to actually help patients or people in the community. And when you're a hospital-based pharmacist, you actually get a lot of roles. And one of those is the research analyst. Another role is a pharmacokinetic advisor, one who has expert skills. And lastly, of course, a patient advocate. That is very important because sometimes that last step of the care plan is the person who sees and understands the most and brings it all together and can then access and enter into offices and domains where the patient may not go in order to advocate for that patient's health. Now I'm going to take you into our work environment at the University of Toledo Medical Center. And when we talk about pharmacist interventions, this is where there is some change in the medication because of what the pharmacist sees. He or she goes and talks to the prescriber, whichever that may be, PA, physician, or nurse, in order to say, this may not be the best therapy for this patient, this may not be the best dose for this patient. And with our population, in a period of time that they were on rounds, we had a total of 1,500 interventions. Each one of those has the potential of saving money. All of them have the potential of actually improving health. And this is from Michelle Mangan's work. Also, we shall talk about in this context in her clinic with diabetic patients. We understand that around the world and even here, that diabetes is the problem for people. It has to do, of course, with the good food that we enjoy and the lack of exercise that we run away from because we enjoy the good food and everything else that goes along with life. And of course, we know that then you have a problem with maintaining the correct level of sugar in your blood and the markers for that. In her case, she had a great, what we call a grateful patient, a person who actually saw her values decline to those that were better for her particular case. This is just another example here in the Medical Center as well of what happened with systolic and diastolic blood pressure as well as the A1C levels in the patient population in terms of how they flew with baseline. And this, of course, relates to the patients who completed the program. If we can get them involved, if we can get them involved in maintaining their own health, the outcome is going to be much better. A key thing in America right now is readmission. That is to say, within a 30-day period, if I'm in for a heart attack or whatever the case may be, we don't want to see that patient back in one of our beds within another 30 days. So we do a lot of things to avoid that. And in this case, there's a lot of inpatient education that goes on. And those who had diabetes and who, I should mention, Anita Ritner and Julie Murphy are the two people who actually lead this particular care plan for us there at the Medical Center. Those who, prior to the implementation of the education plan is shown here, and those who, after the implementation, you can see the improvements that happen. Myocardial infarct is about the same, but improvements here in the others. Pharmacists make a difference. And this shows, again, another view of the kinds of things that our pharmacists do in the way of interventions. 1,700 in this case of interventions by our practitioner faculty and even our residents and occasionally our students. When we look at something else that we do in the Medical Center, this emphasizes the role that our students even play. The basic, I should mention that this measure here is something that's also important in our system because it's looking at the 30-day readmission rate. Not only that, but beyond that, what is the level of patient satisfaction with what happened when they were patients? That's important because if it's not a good number for you, you're not going to get paid. We look at the indications that are happening, we look at the side effects, and here it's not just the pharmacists, but it's also the students and our residents who are involved. And the script, of course, starts all of this. The script key is a part of it because we tell the students or whoever it is what we want to ask, what we want to understand of the patient. We give the person when they're about to be discharged information package, and we also establish a hotline. And what we have found over the next few slides is that when we do the survey, and I'm sorry for the overlay, I'm not sure about shipping, but when we do the surveys of patients afterwards in terms of indications or the side effects, they agree that we've done a good job in managing those areas, and of course that helps keep them healthy. Over-the-counter medications is something else that is important to the practice of pharmacy worldwide. We know that the domain varies worldwide as well, but that class of medications is accessible to every patient, and that person then has to be guided in terms of the use of that, the use of traditional medications, and of course this is another opportunity for the pharmacist to make an assessment. I am distinguishing assessment from diagnosis. Diagnosis, of course, is what our colleagues in medicine do, and do so well. We in our setting handle the prescriptions, compounded medications, and of course we refer to the medical advice provider. Within America as well, my abstract talks about one of the things that one of the services has found is that when a person comes into a pharmacy, if they are engaged by a pharmacist, that that person's skill as a practitioner is used, but also the other things that are available in that pharmacy are accessed by that particular person. So having a pharmacist involved is quite important. It has to reduce the risk of various illnesses that can be prevented by immunization. And in our country, the number of pharmacists trained has gone from 40,000 to 260,000. When I visited my own physician in our private family, the nurse gave me the immunization for my own wife to take home so I could take care of her. Vaccinations in the community setting, 6% of adults in 2004 were now 18% coming to a pharmacy in America to get an immunization. When I think about adherence, that is to say the patient's ability to stay with the medication, I think about my maternal grandmother, Rosalie. When I was yet in pharmacy school, I went in to visit her, and on her dining room table, I saw the vial of digoxin. Now, you know, just halfway through pharmacy school, you begin to know a lot, but you don't know everything. But one thing I did know, when I looked at the date that the medication was dispensed, and I looked at the number of tablets in there, I knew that she was not taking them appropriately. And when I challenged her about that, I'm wired for sound now. When I challenged Rosalie about her medications, she was a little embarrassed, probably a little angry at her grandson, because I was saying to her that this is not a medication you can take when you feel bad. You have to take this one every day as prescribed. That is yet another role for pharmacists, because when patients are on medications, especially long-term, or even a 10-day antibiotic series, you know that as soon as the person thinks they're well, the medication stops. And so a clear role for pharmacists is to make a phone call if the person has to come in for a refill. And in my case is that you go through a person's home to notice what's there and to give some advice and counsel. Now, I have to tell you that my grandma, after that exposure to me and my learning, I never again saw a medicine vial on her table because she didn't want me to fuss with her about not taking her medications. We also know that there are challenges around the world in various levels and various places about child-appropriate dosing. Let me go back. And we know that there are minimal needs in terms of whatever a country knows its conditions of its people to be. And those medications are based on their effectiveness in terms of therapy and also in terms of cost, are things that you want to really have on hand as a priority. Those conditions then are selected by the country, and they intend to have the things on the shelf that you need. And you want that because it helps to define a functioning system, a healthcare system to have those essential medications in appropriate amounts, in the right dosage forms, and also have the quality and the adequate information both assured. And the price, of course, is very important to be affordable. This is true for both adults and certainly true for children, because we know that in various places at various times that we have trouble actually with the appropriate medication for a child. Many times that medication is not simply just grabbing something off the shelf, but there's more to it than that because of the organ systems of that person. That is important, and the Ministry of Health and all concerned have to be involved in providing the right kinds of medications for that population. Consensus has to be developed, and people have to advocate for that patient population. And if you look at it, Uganda is one example that was cited recently by WHO. We see that there are particular challenges there that they've not been able to meet, despite having the intent and desire to meet those. And we know that there are various parameters that we know so well that are important to providing adequately for the younger part of our community. And we know also that we have to be sure that even the order is written appropriately. If you would allow, give you this pardon the pun, but a little bit of a dose of about the people and the programs of Toledo, and let you know that first in our area of the world in America is a very good place to come and live. The people who of all different origins, we've had what we call a peaceful integration. There are half a dozen active mosque communities within our domain, and also very good businesses. My favorites are the restaurants that I enjoy. It's a model community in many ways, and it is home to, Toledo is one of the largest mosques in America. It is near, now the slide that I'm showing here is actually from our last homecoming parade, and this is of a Muslim Student Association bearing the flags of several countries that are part of our Toledo student community. We have many assets at our university that are meant to help with bringing in people from diverse parts of the world. We're quite pleased with that, and we do enjoy it. And of course, we brought in people who we've collaborated with, and this actually is a picture taken on the banks of the Maumee River. And you see a very important and famous face right there in our deed. And of course, we are always pleased to be a part of this gathering and this conference. And we also know that our laboratories and clinics have been sites of exchanges for students and faculty as well. And we have many things that we are pleased with in our college, starting with a pharmacy camp for people, young people who are in high school. And this is something I want to recommend to you. I have information on that, and of course, all of us know about our doctor of pharmacy degree program. And we have several degrees in the bachelor's area as well. It is a comprehensive college when you look at the breadth and depth of the educational programs that we have. And we also have a pharmaceutical care outcomes and research laboratory, first of its kind, established in 2005, that does some important work as it relates to health outcomes. And we also have the Center for Drug Design and Development, which does, as its name suggests, the College of Pharmacy Research Index I actually have on this jump drive. It shows that some 87 different terms describing the work of our faculty. And I suggest to you that here at Asatuna, that there's opportunity for collaborative research of various types based on the 87 items that we find there. I listed some of them there just to give you a teaser. And with that, I will pause and say thank you for giving me your ear and your time this morning.
We have a few minutes for questions, if any. Yes.
presentation and welcome to Jordan. I met you before 2 years. And tell with me about the residency program. How many specialties you cover in the residency program for your PharmD student? Is it limited for PharmD students? Does it have certain requirements? And another major concern that I have always to say it, that we should not leave the formulation and the pharmaceutical industry far beyond. So we have to pay attention to both in parallel lines. The first one for pharmacy practice and the patient consent, because this is our job, to give the patient the right medication and the proper dose without any possible side effects or with the least possible drug-drug interaction. But if we want to leave the formulation and the pharmaceutical industry for whom we are dealing with, shall we use a chemical, for example?
On the second point, we're in agreement that we cannot abandon that domain because we do it best, we know it best of all the disciplines that are out there. There's no substitute for what a pharmacist brings to the table. And if I understood the first question, it had to do with the educational requirements for the PharmD. Well, actually, I think the answers may be here. Yep. Yes. Okay.
Well, one more question, please.
Thanks a lot. Thanks a lot regarding this nice presentation. You said that pharmacists are involved in immunization and they got training in this field. I was wondering what types of vaccines pharmacists do usually give in their community pharmacies, and do they have to have a certificate for that or not?
Yes, there is a certificate that is required in order to be able to provide the immunizations. In Ohio, I think we are approved right now for up to 17, and that goes from the very young child all the way up, of course, to the adults. The most frequent ones for immunizations are for the influenza, and the other is for shingles. And of course, you see measles and all of that in the community as well. When you are hired to be in a pharmacy, be it an independent, as we call it, a community pharmacy, or if it's Walgreens, CVS, or Rite Aid, you will not be hired unless you have a certification as an immunizing pharmacist. The fact of the matter is that in our pharmacy schools, it is a part of the curriculum that you get that before you graduate.
Okay, I would like to thank you, Professor Early, for this presentation. Thank you.
You wake up.
Let's go to the second speaker, Professor Dr. Nasser Sharif, Professor at School of Pharmacy and Health Professions, Creighton University in Omaha, USA. He received his PhD in toxicology in 1992, and he received a lot and several awards in teaching, research, education, and pharmacy. Now he's going to present his presentation title in Pharmacy Education and Practice in the Era of Globalization, What is Needed. Welcome, Professor Nasser.
شكرا. صباح الخير ولا مساء الخير؟ لسه صباح الخير؟ صباح الخير. السلام عليكم جميعا. I want to thank Dr. Lassan and the organizing committee for inviting me. This is not my first time here in El Zaytuna. I remember the same setup, the same speeches almost that we had at the beginning, almost what, 6, 7, 8 years ago? and it was a wonderful experience. But I've been coming to Jordan for the last 22 years. It's amazing to see some of the students that I came in 1995, now they're all with PhDs and teaching everywhere, from Petra to Jordan, so it's always a pleasure to be back in Jordan. Now, the title for this conference is Pharmacy Practice, Pharmaceutical Sciences, right? A global perspective. So my presentation is from that perspective, a global perspective. Because a lot of times when we think about globalization, we're not thinking in terms of the big picture. So I'm hoping today to give you an idea, at least my biased opinion, in terms of what this global picture should be, both from pharmacy practice, but also from pharmaceutical sciences, research, and so on. So that's where I'm coming from with this presentation. What are we going to discuss? Why global pharmacy education and practice? Why should we do this? Why should we think globally rather than locally or regionally? And I think that's a very important question. Why pharmacy education and global outreach? In the United States, this has been going on, so I'll give you a kind of summary of some of that outreach from the perspective of the United States, my biased opinion, living in the United States. But it's happening all over, in Europe, it's happening here, regionally, and so on. I think you cannot talk about globalization without talking about best practices. And sadly, when you talk about globalization from a business perspective, many people are kind of a little bit suspicious of globalization from a business perspective. So I'm going to talk about the lessons that we should learn in terms of globalization from a business perspective and how we should think about it from a health perspective, and more specifically, from a pharmacy perspective, okay? So identify those lessons and so on, and then discuss key aspects in terms of us as a profession, whether in terms of research, practice, and so on, what we need to do, and what are the key issues. But as you sit here, I want you to also think about Jordan. You know, some of the stuff that I say here might be related to what you do here in Jordan, some might not. So I want you to reflect about some of these things and what it means for you living here in Jordan or regionally. There's people from Palestine, from Qatar, from other parts of the world, Italy, my understanding. So think about what it means for you from that perspective. I live in the United States. There's an argument, where is the middle of the United States? It's Omaha, Nebraska. How many of you know where Omaha, Nebraska is? Dr. Aioli, of course. Anyway, Omaha, Nebraska is in the middle of the United States, and it's right on the east corner next to Iowa. But the reason I put this map is, you know, in the past, coming from the United States to Jordan or this part of it, it was kind of a major thing. But now people are moving across borders, they're exchanging information, and certainly with the internet and the technology, we are really closer than ever. So again, when we talk about globalization, it is such an easy thing to do now because we are much closer to each other. And it is almost as close as the arrow that is showing from Omaha, Nebraska all the way to Jordan. So to start with some definitions, when we talk about globalization, what is education globalization? What does it mean if we want to globalize education? And it's to be conscious of the interdependence of nations. We're not isolated entities. And especially when you talk about science, when you talk about education and health education, we're all interdependent on each other. We share the same problems. So we need to start thinking differently about globalization, especially again from a health perspective. We have to appreciate the diversity of society. We cannot just say one thing fits all. So we have to still appreciate the diversities of societies and the necessarily global nature of the world's problems. If you think about drugs in general in terms of what are the issues, medication safety, is that an issue here? Are you with me?
Yes.
Is medication safety an issue?
It is.
Yes. There are many issues that we all share here, and hopefully we can identify things, you know, in terms of helping us all. Recognizing the importance of cohesion and solidarity in modern society, it would seek to promote new and more inclusive forms of national identity, again, to cross borders and so on. When you talk about global health, It's an area of study, research, and practice that places a priority in improving health and achieving equity in health for all people worldwide. So what we do in the United States, what is happening here, what is happening in Europe, we're all interdependent on that. We're working for the same thing. And you could relate some of the other stuff in terms of collaboration, interdisciplinary teaching, intra-professional education, and other aspects of this.